get active. All this information we talked about, get active, because it does make a difference. And at least a little bit that you do makes a big difference. Anybody know what this is besides a watch? Anybody? Besides just the experts in here? Huh?
Step counter?
No, close. Close. It's a heart rate monitor. Okay, I'm wearing a reminder on my wrist, that, man, you know, I need to speed it up when I'm walking, wherever I'm walking to, at work, somewhere. I need to speed up. I want to check my heart rate. I want to burn those calories. Okay, do simple things like that to kind of keep it on your mind to be a little bit more active. Okay, the other one here, eat breakfast. Most important meal of the day. Most important meal of the day. And I tell my clients when I first start out, if you haven't been eating anything, and you've been waiting until 12 o'clock, that means you don't went to sleep from, let's say, 10 o'clock all the way until 10 o'clock again before you have any fuel in your body. I've never seen a car run with no gas. Never seen a car run with no gas, unless it's going downhill. The wrong way. Okay, but when they got to go back uphill, they got trouble. Okay, so I've never seen that. You got to fuel your bodies. You got to do that. Okay, find out. I ask my clients, what are your goals? What's your goal? Oh, I want to lose 20 pounds, or I want to lose 20 pounds, whatever the case may be. And you know, the question is that it's not how much weight you want to lose, it's how much body fat you want to lose. That's the thing. Because if I weigh 200 pounds, my friend, he weighs 200 pounds, but he's 35%, you know, obese. Oh man, he in that danger zone. Okay? So when you do that, that scale, it tells you a number, and that's all it tells you. It ain't telling you how much percentage of that is fat, how much percentage of that is muscle. Okay? So understand, you can lose 30 pounds and man, it can be mostly fluids, or it can be muscle mass. Okay? So understand that. Eating habits improve those things. Supplements, they always come in. We talked about how the foods are. Food, they're on shelf to last for long periods of time. You can let a can of beans stay on the shelf for a year and still open them up and you can still consume them. But are they nutritious? Okay? Read labels. Man, I tell you, boy, labels are something. Read those labels because they tell you about this trans fat and 0 calories and half. No, not true. Not true. Okay? So just be on top of some of the things you're doing. I got one slide, but I'm going to talk a lot. Okay? So you just got to deal with it. I got one slide, so you just got you got one button to push for me. Let's kind of get into it, kind of talk about things, but just to build up. Can everybody see this here? The blue? Yeah. Oh, this here is pretty much blue. This is in 1997. 1997, and they talk about as far as obesity. Okay, in certain states, the highest one was between 15 and 19% of obesity. 1997 here, okay? We're talking about, at the top, we're talking about white people, Caucasians, okay? We're talking about the highest being 35+% obesity. And you see, the lowest is, you're talking about 20, less than 20% as far as obesity, okay? Pretty good, right? It's pretty okay. Then you get down here into Hispanics, the color starts to change again. Okay, starts to change. Okay, we got a few states got one state that's in that 35+ percentile as far as obesity. You got one state. Okay, now blacks. Blacks. That's us. That's our community. That's our culture. That's what I'm talking about, our culture right here. Okay? But for people to be so athletic, naturally athletic, we don't have to train pretty much to do anything to put our minds to. It kind of comes natural to us, okay? But look at, man, this thing is 35+. Okay? So that's what's so alarming. That's what's alarming. And again, we're talking about small changes as far as what we do to make and bring that number down. Okay? And I talked about what was 22 million folks with diabetes, but it's probably now more than 44 million people who are obese. Obese. 40, that's probably a year ago, that number, so I know it's probably improved just a little bit. Obese. Okay, so when you come to me and everybody want that overnight type success. Everybody want to take that little pill. That when you wake up that next day, you know, from Beauty and the Beast and all that, they expect that overnight type of change. Well, it didn't take you that fast to get to where you are. You know, so we don't give our bodies or our minds time to change and adapt. Okay, so it's very, very important when we talk about this stuff. Be patient with yourself. Be patient with your body. Nurture it. Nurture your body to where it's, you know, it's gonna, you allow it to change. And it'll change before you know it. Okay, it'll change. All right, we talked about fat cells and its influences on diabetes. And we went through the game, we kind of explained as far as what we're talking about with diabetes and predisposed diabetes. Okay, sweetheart, you want to get my fat out of there? I got a little display, and I always use this here display whenever I'm talking to a group of people and they talk about fat. And, you know, everybody want to have the bodies and all that stuff like that. But this is a pound of fat, okay? And that's a big piece of fat, okay? We just talking about 1 pound of fat that's in your body, okay? Now I want to compare it to a pound of muscle. And we're going to see, get the muscle this moment. Pound of muscle. Muscle and a pound of fat. Okay? So, when you starve yourself, what's the quickest source of energy or fuel your body's going to probably go to first? This muscle. This muscle. Okay? And again, when I talk about, you know, cars don't run with no gas, I use other times, I use as examples when you see those third world countries. They have, you know, the starvation and the people dying in all these different countries. What's the only thing what's the 2 things that stand out on their bodies?
How big their stomach is and how skinny their body is.
And then what's the other big part of their body?
The head.
The head. What are those 2 areas composed of mostly?
Fat.
Fat. Fat. But the bone, the arms, the legs are skinny. Why? Because the ready source of fuel is going to be the muscle first and the fat last. Okay. So that's really what we're talking about. If you don't put the proper nutrition in your body, and if you don't understand what's happening when the insulin, instead of being pumped into your blood, and you're not exercising, you don't turn into glucose to burn it off, where is it going?
Fat.
That's where it's going. And you're setting yourself up to be a diabetic. Okay? And once it gets there, then you want to try to do something about it. It's hard. Again, your lifestyle has changed big time. Okay? Get a checkup. The other thing is, now I'm about to show you another speaker. And I don't have, and if you can imagine just from looking at this here, what this 1 pound, imagine what 5 pounds look like. This 5 pounds of muscle. 3 times the size of this here is what fat's gonna look like. Okay? That's what fat's gonna look like. Okay? So unless you get active, that insulin is not gonna turn into glucose. Okay? Where you can burn it off. Okay? It's not gonna happen. You're gonna be carrying around all that extra weight on your organs and all those things, and it's not gonna happen. It's not gonna happen. Okay? So my thing to you, please, for starters, okay, schedule yourself to get physical. I get 2 every year. I don't mess around. He tired of seeing me. I said, you're gonna get my money. You're gonna get my money because I'm being proactive. You're gonna get my money because I'm being reactive. And I got all these ailments, so you can just keep prescribing all this medication to me. It ain't gonna happen. Ain't gonna happen. My daughter, she reads labels. She reads labels. She is conscious. But they already went to McDonald's once this week. I can't have it. That's good. But we got to break the chain. We got to break the chain. We got to teach our young people to eat right and to exercise. Okay. About?
Oh, yeah.
Okay. That's all I have. Thank you.
How many people here are actually diabetics? Can you see your hands? You're actually diabetics? Okay, good. Could everybody do me a favor? Just stand up, walk around. Everybody in the room. I'll get to the reason why I'm going to mention that later on in my presentation. Just kind of stretch out a little bit. All right, whenever you're ready, As I was sitting here listening to the presentation that was going on before me, one of the things that really hit me was, and it's not part of my presentation, it wasn't until I was sitting there, I'm a pharmacist by trade. Spent 19 years and 2 months at Walgreens, 4 years at Hillsborough 22nd, when it was on the other side of the street, and 15 years and 2 months at the Fowler location. And one thing that I see diabetics. And I see them at a point where just the little things that people are saying to me, they have a different mindset. They think that by starving themselves, they actually lose weight. And it's actually the other way around. I can't tell you the amount of people that would come into me and say to me that I haven't eaten all day, I've had a can of soup. It's countless. So the information that you're being presented with here today from all the speakers before me, please, those that are not diabetic, share those with your family members. And your family is not just your family here, your church family, your family at work. Share that with them, please, because it's very important. It's lacking. And I see it. My partner Alex, he sees it also because he's a pharmacist also, and we see those things. We see those things on a regular basis. My topics are going to be a lot similar to a lot of things that were said before me. I was looking at Emerson kind of disappointed because he kind of stole a lot of my first part of my speak here. But a man once told me that in corporate America, for a person to get an important course, you got to hear it 6 times.
Right.
That's the only way you're going to get it 6 times. So I think Tillman did about twice. I'm going to try to do the other 4.
Right.
Well, at the start. Diabetes is a chronic. When you hear the word chronic, think lifelong. It's yours. We used to have a thing in school, when I was going to school, whenever somebody would break like a glass beaker or something like that, we just say you bought it, it's yours. You don't just keep it. It's your disease. It's marked by high levels of sugar that's in your blood. As doctors and pharmacists, we call sugar glucose. That's what the people say. They have high blood sugar. We just say you have a high glucose level in your blood. It's a problem that's caused because your body is either not making insulin or it's not using insulin properly. Insulin is a hormone. It's secreted by your pancreas, which is located behind your stomach. And what insulin does is, and we've been told, is that it takes the blood sugar glucose from out of the blood and into the cells where it's stored. First thing I want to go about, the first complication that I'm talking about is dialysis. You have two of the major organs in your body is your liver, and your liver metabolizes. By that, it breaks things down. It's going to break things down that we take in. And the next one is your kidneys, and your kidneys is a filter. It takes that now, it's going to put it in a form that it can excrete it. What happens is that when you have high blood glucose levels, the sugar, the excess glucose in your blood, it runs to the kidneys, and your kidneys capillaries, it can't filter it out. It can do it for a certain amount of time, but it comes a point where the kidney is just overwhelmed. And at that point, that's when you have to go on dialysis to have the machine do that actual process for you. On a proactive, for people that have diabetes, you have a much higher chance of developing heart disease, kidney disease, and other medical problems. What happens is that, what happens to you at those points is, a lot of your doctors might put you on different types of medication to either treat or prevent these things from actually coming on you. A lot of these things called ACE inhibitors. You have things like Capitan, Captopril is the generic name, Predavil, which is lisinopril, Vasitec, Enalapril, Lotensin. All of those you might be on. It's actually trying to prevent the kidneys from having any problems. The next area that okay, diabetic neuropathy. You see these it's basically the nerve damage. What happens is you have blood sugar, and it causes nerve damage due to the excess blood sugar that's above normal. Your blood sugar levels damage not only your blood cells, but the blood vessels, but also your nerves. What you'll see is your heart, the ability of the heart to keep up with what the body needs. You're straining feeling different parts of the body parts. Your ability to digest foods, and for men, the ability to have an erection again because of the damage that's been done to your blood vessels. You see also when you have damage to your nerves in your legs, you might not feel pain. The way that the Lord made our body, things like temperature, whenever a baby has a fever, even if you have a fever, it's letting you know that you have an infection someplace in your body. Go ahead and take care of that. When you have pain, it's letting you know that something's wrong in your body. You need to look into that. So when you're done with this feeling of pain, it's quite alarming, because what can happen at that point is that you just don't sense what's going on in your body properly. Your muscles might begin to atrophy. Simply, that means just that your muscle size actually decreases. And what happens is that you see people that have problems walking. It leads to that. Your skin might crack and develop sores. We're going to get into that a little bit later on. Your feet. Okay. Because the blood flow has been decreased, it changes your actual ability to fight off infection. Your diabetes can damage your nerves. Again, this makes you less able to feel an injury or pressure on your feet. You might not notice the injury until it becomes more severe, and that can lead to infections. Damage of the blood cells is, what happens at that point is that you have less blood and oxygen going to the feet. That's what's needed for you to heal. Small breaks in your skin can become deeper skin ulcers at that point. And then the ulcers, if they don't improve, they get larger or they go deeper into the skin. And then you can start talking about things like amputations. We don't really want to go there. But it's not only amputations, okay? That's the first cut. That's the first cut. What happens at that point is your body, if your body's not healing again, then they got to cut again. Then if your body's not healing again, then they got to cut again. That's why you see people, gradually, they start off as just cut after cut after cut. So we're trying to prevent all of that. And that's the good part of my talk. I'm not a negative person on a whole. So let me give you some solutions to it. It's called control. It's called control your blood sugar. There's no excuse for it. I'm sorry. I've been there. Like I said, I've been in this area for 20 years now, and it's just a matter of control. There's no reason. Most of your insurance, we have Elder Floyd out there. If you haven't seen him, see him. Most of your insurances now cover some form of testing, some form. Not only, you don't have to go to the doctor's office, you can have that stuff in your house. Most of them now, I think for the last 5 years, they have alternate site testing now. Alternate site testing means that you no longer have to use your fingers. You can use your thighs, your arms, because your fingers are more tender. So people still used to have to prick their fingers, and also the quantity of blood that's needed as a sample has decreased dramatically. So there really is no excuse. Most of the insurances, if not all the insurances, cover some type of testing for you in your home. Stop smoking. I feel almost that's wrong for me to be even in the center of manifestation talking about smoking and drinking alcohol. But we need to stop smoking. I'm not saying you go to hell for smoking, but you just might smell like you've been there. But you should really stop. You should really stop smoking for this reason. you decrease the blood flow to your feet. You decrease the blood flow to your feet. See a doctor and get a full exam at least twice a year. At least twice a year. What you can do in the meantime is, what's the next slide? As far as, you should daily inspect your feet. Daily. You want to look at the top, soles, the heel. You want to look in between the toes. Wash your feet with lukewarm water and mild soap, not hard soap, because that can actually damage the skin. You want to test the water with your elbows, not with your feet, again, because your nerves your nerve damage might be there already, so you want to test it to make sure that it's lukewarm. Gently dry your feet, gently and thoroughly dry your feet, particularly between your toes, because the moist areas they tend to lead to infection a lot easier. Soften dry skin with lotion, but not between your toes. You want to also ask your doctor how to best groom your toenails. Very important. You don't cut your toenails on a curve. You cut them straight across. So if you cut them on a curve, it's very easy to get ingrown. So you want to cut directly across. The reason why I had you stand up at the start, because when you're sitting, your blood becomes stagnant. You want to be up every 2 hours. Every 2 hours. If you're on the airplane, get up, walk to the bathroom. If you're driving from here to Tallahassee, use the rest stops. Not just to use the rest stops, but to walk around your car. Just get out, walk around your car. What you do with that is you're preventing blood clots from actually forming at that point. Wear shoes. No flip-flops, no sandals, regular shoes. Regular shoes. If the thing about shoes also is check the inside of the shoes. See if there's anything that's there that might cause some type of irritation. You want to prevent the problem, so you want to be proactive. Change your shoes, if possible, every 5 hours. There's certain things you got to do. The only thing that does is it changes the pressure points in your feet. So you want to change your shoes probably every 5 hours. If you have poor vision, you might have to ask somebody to check your feet for you. That's just the bottom line. Because it's that important. It's that important. Next time. No, back, I'm sorry. Thank you. Okay. Diabetes is the leading cause of blindness for younger Americans. We find, again, because the increased blood pressure as well as sugar, it can damage the retina, the lens, and the optic nerve, which is most commonly glaucoma. And the first one, we see that blurred vision is usually a fluctuating blood sugar. Mrs. Tillman showed that, as well as Mr. Tillman showed that slide. And what happens at that point is that the shape, the lens of the eye actually changes. And that's what causes your vision to be blurred. If it stays permanently blurred, you want to see a doctor as quickly as possible and an ophthalmologist. Glaucoma in, for glaucoma, we have normally in the whole population on the whole, starts over 60, family history of glaucoma, African Americans, which are us. Your increased risk of glaucoma increases with diabetes and extreme nearsightedness. The term that's used to describe several types of these eye conditions. Previously, when I was in school, it was just thought it was increased intraocular pressure. Now they're coming out with it saying that might not be the case. You could have normal pressure, but it's just the case that the optic nerve has been damaged. Not damaged, I'm sorry, the optic nerve died, which means it's irreversible. Once it died, they can't do anything about that. It usually starts with your peripheral vision. You can't see out the sides, and then eventually it can lead to blindness when it goes to the middle of the eye. The largest segment of glaucoma is what's called primary open angle glaucoma or chronic open angle glaucoma. It simply means that they're having a problem draining the liquid out of the eye.